The topic tonight really came out of Joan, who couldn't then be here. This is her topic. But she had said that she couldn't demonstrate with me because she didn't know how to focus. And I had said, well, a focusing-oriented therapy has nothing to do with what the patient knows, what the patient does. It has to do with what the therapist knows and what the therapist does. And that became a controversial statement. And tonight I'm adding to it the controversy and saying it has nothing to do with paying attention to your body. The patient doesn't even have to be in touch with their body or know from a body. Well, that's a good question. I'm going to be very controversial and say the therapist doesn't have to pay attention to their body either. And then it will be very interesting to see how we discuss this, and I'm expecting you to argue with me, which will be very fun. How can this be when in Jenlin's article, The Client's Client, that we discussed here, the upshot of the article is that what therapy is about is the patient learning how to focus, patient learning how to have a different relationship with themselves. In other things that Jenlin has written, like his book, Experiential Psychotherapy, there are initial chapters about what the therapist needs to do and then what the client needs to do in order to have a focusing-oriented therapy. So how can I say that the client doesn't have to do anything? How can you have a focusing-oriented therapy if the client doesn't know anything about focusing, doesn't know anything about tuning into that level, doesn't know anything about a body sense? How can that be? So I'm going to give you a little justification for my statement, and then I'm going to open it up to you to argue with me. The way that I see it is that focusing-oriented therapy is not a method that's used only for people who are in touch with that feeling level, people who have an aptitude for sensing their bodily felt sense. I mean, of course, this method is wonderful to use with people like that. But this method, this sensibility, this understanding, not only can be used with any client or patient, but is wonderful to use with people that are talking intellectually from their heads, or spilling over emotionally with the same emotions again and again without any sense of separation or sense of being able to reflect on their feelings. So those would be the two poles of being furthest from a focusing understanding. Would be the pole of the person who is, as we used to say in the old days, talking from their head rather than their gut, right? And all of us do that at times, and all of us have patients that do that all the time. And you say to yourself, how am I going to get to some feelings here with this person? And often you don't get to any feelings there. So that's one pole that's very far from focusing, and the other pole would be the person that comes in a rage every session, saying the same things, and there's no way to sort of get in there and say, well, what is that about, or how is that, or anything like that. Or someone who is in despair and or in tears, or that where there's absolutely no separation. You know, so those would be the two poles, and I'm saying that a focusing orientation is wonderful with those states also. Focusing, Jean says, doesn't take place inside the client, but inside the interaction. And this is the same thing that intersubjectivists say, that therapy takes place in the intersection of the patient and the therapist. Where they meet in this intersubjective field, this intersection is where therapy is taking place. It's in the us. It's not in the client. So if we follow that understanding, if we take that understanding seriously and we follow it, then what we're really saying is that if there's a dyad that is inseparable, that this can't be separated, the I and the us. And if that's true, or in the way that that's true, then if the therapist is going to this level, then the interaction is permeated by that level, right? Because the patient then becomes part of this us, and the therapist is bringing the us down to this level. Now, of course, I sound a little Pollyanna-ish here, because of course we know that with some people we try to bring it down to that feeling level, and the client is saying no, no, no in many, many ways, and taking it up to another level. So it's not so simple as we, you know, that the therapist can bring it down to that level. And we also know
it's really more that it includes that level.
It includes that level.
Right, the intersubjective field
includes that level, yes.
Everything has to drop down.
Exactly. We also know that when the client learns something about focusing, my job is a billion times easier when the client knows focusing. But my job might be easier, but it's not impossible when the client is allergic to focusing. How does do this? How does the therapist permeate the intersubjective field with this felt sense level? But really what the therapist is doing is focusing. But the therapist is focusing not only on their own felt sense, but they're focusing on their felt sense of the patient's communication, of the patient's felt sense. It's almost like a vicarious focusing. So first of all, the therapist will be aware of this level. But the therapist that knows about this level will be listening for how it's there in the background, even when the patient is utterly unaware of it. The therapist will be sensing in their own bodies, but I said they don't have to pay attention to their bodies, because maybe they won't be paying attention to it as body, but it will be happening in the body, whether you are paying attention to the body or not. You might be thinking about it as an energy, or as an emotionality, or as an intensity. But the therapist will be paying attention to their own felt sense of what the patient is talking about. And the therapist will be evoking, welcoming, inviting, encouraging, expecting, sort of like looking for a guest at the door. You know, when you're expecting somebody and you keep looking for them, and when are they going to come? When are they going to arrive? Then maybe there's a storm outside, or they're caught in traffic, and You know, every pore of your body is alert to when are they going to come. And that's the way a focusing oriented therapist is about this level. When is it going to show up? How is it going to show up? Oh, it's there almost any minute. Oh, no, it wasn't that. I thought it was, but it didn't come yet. Like that. And in that evoking, inviting, welcoming, the therapist also sort of knows where to wait for it. You know, waiting at the door. Knows how to use poetic, evocative language to encourage it. The therapist then recognizes it when it appears in a shadowy form. And the recognition of it would be recognizing this level because of the freshness of language, the metaphor, the sense of intensity that comes in a word or a phrase, maybe a body shift, maybe a different sense of intimacy that comes right there. Maybe the patient might look down for a minute or look up, but there'll be some harbinger of there's something that's peeping out. We call it a level, but it's also a part of the person. We could call it the inner self or the feeling self that's peeping out there in some way. And the therapist recognizes this also by the emotional logic instead of the linear logic, and begins to articulate it. And what came to me to say in my notes that I really liked is that the therapist begins to say the unsayable. In my background, we used to talk about the importance of saying the unsayables. All of the things that are taboo to say are the most important things to say. And in this meaning of saying the unsayable, I don't necessarily mean taboo, although many things that are beyond words are taboo. But all of the implicit that's beyond words are unsayable because they're implicit, because they haven't yet come into language. So the therapist is forming that implicit juice, that stuff of feeling into words. And that's a focusing process, that articulation of saying the unsayable. And then the therapist is able then to offer that back and to watch carefully for the reaction of the patient. And all of that is almost like the mother bird feeding the baby bird. The therapist is doing this focusing process and including the patient in it. And the patient may come there, or the patient may not. You may put the worms in the baby's mouth, and the baby may spit them out and spit them out and spit them out. But then even when the baby spits them out, and you say something like, "When I talk like that, it's really annoying to you," that's getting to that level, right? So it isn't that there has to be any particular reaction. It's just whatever implicit reaction there is, you are articulating that unsayable.